The human body is composed of living cells, tissue, organs, and systems. Each organ has its own role to help individuals survive in daily basis of life. Let us know the different organs that plays an important role in our body and the different diseases that involves in each organ as well as the causes and effects of each diseases in the human body.
Thyroid. The first organ is the thyroid. It is a butterfly-shaped gland in your neck just above your collarbone. It is one of your endocrine glands which make hormones. Thyroid hormones control the rate of many activities in your body. These include how fast you burn calories and how fast your heart beats. The disease that can be associated with thyroid is hyperthyroidism. Hyperthyroidism, underactive thyroid, is a condition in which your thyroid gland doesn't produce enough of certain crucial hormones. A variety of conditions can cause hyperthyroidism. Graves' disease, an autoimmune disorder, is the most common cause of hyperthyroidism. It causes antibodies to stimulate the thyroid to secrete too much hormone such as tumors of the ovaries or testes, excess iodine, and plumber's disease. The symptoms or effects of hyperthyroidism in our body are rapid heart rate, elevated blood pressure, and hand tremors while in a hypermetabolic state. A person sweats a lot as well and develop a low heat tolerance, nausea, vomiting, hair loss, and itching. Hyperthyroidism may cause bowel movements more regularly, weight loss, and irregular menstrual cycles in women. The diagnosis of a person if he or she has a hyperthyroidism are through ultrasound, cholesterol tests, and to get a complete medical history and physical exam. The medications for hyperthyroidism are antithyroid medicines, such as methimazole to avoid hormones from being released by the thyroid. This is a common treatment. Next is to undergo a surgery. A section or all of your thyroid gland may be surgically removed. You will then have to take thyroid hormone supplements to prevent hypothyroidism. And lastly is to undergo radioactive iodine therapy. To prevent having hyperthyroidism or preventing it to become worse, you need to take proper and balanced diet. Focus on intake of sodium and calcium to prevent hyperthyroidism, and to take vitamin D and calcium for the bones.
Next is the lungs. The lungs are a pair of breathing organs located at the chest, which remove carbon dioxide and bring oxygen to the blood. There is a right and left lung. The common disease for the lung is pneumonia. It is an illness that inflames the air sacs of one or both lungs. Fluid or pus, purulent material, can fill air sacs, causing cough with phlegm, fever, chills, and difficulty in breathing. The causes of pneumonia are a variety of organisms, including bacteria, viruses, and fungi. Viruses including COVID-19. Some of the viruses that cause colds and the flu can cause pneumonia. The symptoms of pneumonia are chest pain when breathing or coughing, fatigue, shortness of breath, fever, sweating, shaking chills, nausea, vomiting, and diarrhea. Some complications that may trigger a pneumonia are bacteria in the bloodstream and lung abscess, which occurs if pus forms a cavity in the lung. There are certain ways to prevent from having a pneumonia, such as to get a vaccine, do not smoke, and practice a good hygiene. Third organ is the liver. It is the largest solid organ in the body, situated in the upper part of the abdomen on the right side. The common disease for liver is the liver cancer. It is a cancer forms in the liver cells. It is more common to have cancer that spreads to the liver than cancer that starts in the liver cells. Cancer that starts in another body region, such as the colon, lung, or breast, and then spreads to the liver is referred to as metastatic cancer, rather than liver cancer. The causes of liver cancer are when liver cells produce changes or mutations in their DNA. Liver cancer occurs when drinking too much alcohol. Loss of appetite, abdominal swelling, upper abdominal pain, fatigue and weakness, nausea, vomiting and yellow discoloration of skin, and white in your eyes. The things that we need to do to prevent us from having a liver cancer are to maintain a balanced and healthy weight, drink alcohol responsibly, and treat diseases that increases the risk of getting liver cancer.
The disease that can be diagnosed in the intestine is celiac disease, sometimes called celiac sprue or gluten-sensitive enteropathy, which induces an allergic response in the small intestine. The causes of celiac disease is that your genes may lead to celiac disease when combined with consuming foods with gluten and other factors, but the exact cause is unknown. The effects of the said disease are constipation, nausea, vomiting, bloating, abdominal pain, fatigue, weight loss, anemia, joint pains, itchy and blistery skin rashes. The best way to avoid celiac disease is to avoid established causes that are harmful to a susceptible individual, such as gluten found in wheat, barley, and rye or cereal products. Being on a gluten-free diet is the best way to avoid celiac disease, and this doesn't change when you're pregnant. The next organ is the brain. It is the portion of the central nervous system that is located within the skull. It functions as a primary receiver, organizer, and distributor of information for the body. It has a right half and a left half, each of which is called a hemisphere. The common disease in the brain are brain tumors and Alzheimer's disease. It is caused by the abnormal buildup of proteins in and around brain cells. People with Alzheimer's experience memory loss, and those people who have brain tumor may experience headaches, seizures, nausea, and vomiting. There is no such ways to prevent brain cancer and Alzheimer's disease, but there are ways to reduce the risk of having those diseases, such as avoid exposure to pesticides and insecticides, avoid exposure to carcinogenic chemicals, avoid smoking, avoid unnecessary exposure to radiation, keeping alcohol to a minimum, and eating a healthy and balanced diet. Heart is a muscle that pumps blood received from veins into arteries throughout the body. The heart is positioned in the chest behind the sternum, breastbone, in front of the trachea, esophagus, and aorta, and above the diaphragm. There are a lot of heart diseases that a person might experience, such as aorta disease and Marfan syndrome, congenital heart disease, deep vein thrombosis and pulmonary embolism, heart failure, stroke, heart muscle disease, and pericardial disease. The common causes of the diseases associated in the heart are high blood pressure, drug or alcohol misuse, chronic rapid heart rate, and heart valve problems. This eventually causes your heart muscle to weaken and sometimes to fail. Blood clots can form in deep vein, usually in the legs. It may also result in a disability and brain cells start to die. The heart becomes weaker, it's less able to pump blood through the body. Ways to prevent the said heart diseases are to control blood pressure as well as the cholesterol level. Stay at a healthy weight, eat a healthy diet, get regular exercise, do not smoke, do not drink too much alcohol, and manage stress.
Stomach is an organ in the body where food is digested, or the soft front part of your body just below the chest. The related diseases in the stomach are gastritis, gastroenteritis, non-ulcer dyspepsia, peptic ulcer, and stomach cancer. The causes of those diseases are irritation due to excessive alcohol use, chronic vomiting, stress, or the use of certain medications such as aspirin or other anti-inflammatory drugs, nerve injury, and stomach ulcers or acid reflux. The effects of those diseases in our body are stomach lining becomes swollen, the lining weakens and often causes changes into the cell, which can lead to gastric cancer, nausea, vomiting, abdominal pain, internal bleeding, and gastric ulcers. The ways to prevent ulcers and any other diseases related to the stomach are exercise more, slow down in eating and drinking, avoid fatty foods, and avoid sweeteners that cause gas such as fructose and sorbitol. Kidneys are one of a pair of organs in the abdomen. The kidneys remove waste and extra water from the blood, which is the urine, and help keep chemicals such as sodium, potassium, and calcium balanced in the body. The kidneys also make hormones that help control blood pressure and stimulate bone marrow to make red blood cells. Some of the diseases that affects the kidney are kidney stones, chronic kidney disease, and polycystic kidney disease. The causes of the said diseases are excess body weight, some medical medications, infections such as strep throat, lupus, Goodpasture syndrome, Wegener's disease, and the polyarteritis nodosa, diabetes, and high blood pressure. Ways on how to prevent an individual from having those kinds of kidney diseases is that he or she may make healthy food choices, engage in physical activities, and manage diabetes, high blood pressure, and heart diseases.
And lastly is the bladder. The urinary bladder is a muscular sac in the pelvis, just above and behind the pelvic bone. When empty, the bladder is about the size and shape of a pear. Urine is made in the kidneys and travels down two tubes called ureters to the bladder. The bladder stones urine, allowing urination to be infrequent and controlled.
The diseases associated with the bladder are cystitis, overactive bladder, interstitial cystitis, and bladder cancer. The causes of those diseases are urinary tract infection or UTI, weak muscles, nerve damage, use of medications, alcohol or caffeine, infection, and being overweight, damage to the bladder lining, which may mean pee can irritate the bladder and surrounding muscles and nerves. Your problem with the pelvic floor muscles used to control peeing, allergic reaction, and smoking. The ways on how to prevent from having a bladder disease is drink enough fluids and avoid salty foods.